Okay, it's an educating time, and I want to talk about visual acuity. As someone who have been privileged to be in an eye sector for 10 years, who have worked with an ophthalmologist for 10 years, I can give you that for free. Now I want to tell you the importance of visual acuity. We know visual acuity is one of the first eye test exam a patient take when they come to the hospital, apart from the non-contact tonometer. And these tests guide clinical decisions of an ophthalmologist. When a patient finish this test, they enter into to see the doctor. Doctor would like to see the visual acuity of the patient, and doctor will also look at the NCT, the non-contact IOP pressure, the result. So I'm trying to tell the people who are in the point of taking this test the need to get it correctly. Now, over the time, we've heard the challenges of patient trying to cram the Snelling charts, whichever one they are using, whether the Snelling, the Logman, the chart they are using. And we've also had challenges of people who try to be manipulative. Maybe they don't want someone who is taking the test to know they have problem in the eyes. No, that mindset seriously should be discarded. That is what we are telling, and I'm telling you this now, that it is important that the nurse or whosoever that is at the point of that VA trying to take the exam, aided, unaided, whichever way, with the person should educate the person. In addition to educating the person should also know or study about the Snelling charts. While educating the patient, you let the patient understand that this test, is the test, or sir, that this is that doctor is used to know, actually, to guide doctor to know actually how far your vision is. Do you understand? So, you cannot just read. See whatever you see, read. There is no manipulation, there is no, just tell the person, let the person understand the need. That's the main important point. Let the person understand the need, because at that point we cannot stand to get it wrong. The visual acuity at each point in time must be tested, and tested correctly with the standard measurement. We know that the standard measurement of the distance of this visual acuity is 6 meters or 20 feet. You shouldn't use less than that. So you have to see you maintain the proper distance for the visual acuity. And you need to understand the importance for you to know that this thing is really, really, really a serious business. And you also maintain the proper lighting. It must be bright. The place you are taking the chart must be bright, and you use the right tool. Once you do that, you encouraging patient to read accurately will give you good results, because it's still that visual acuity that in subsequent visits that doctor we use also to monitor the progress. Do you understand? You will use it. So emphasize the importance of the accurate visual acuity testing. So that's what I want to tell you, because seriously, it is very bad. Especially, there are some. Okay, let me use one example to buttress my point. What I'm saying is very important. Let's take, for instance, a patient came to the hospital, and the visual acuity, perchance, is, let's say, 6/60, and this person is going for cataract surgery. And that cataract surgery the patient is going for cataract surgery. And patient who is reading 6/60, and you go and register 6/18. And after the cataract surgery, let's just say the patient is 6/60 again, or the cataract did not improve. The result did not improve actually, maybe because of other underlying factor, which can be glaucoma. And the patient decided to wake up and sue you. Do you think the documented 6/24, 6/18 you recorded instead of 6/60 because you did not record correctly can save you? At that point, they will sue you. The patient will sue you and you go in for it. Because when they say, okay, print your documenting from when the patient presented to the hospital, and you print and they are seeing a VA that is 6/18 or 6/24. Whereas the actual VA is 6/60. What do you think that can happen to you? For the doctor, if the person is serious about the situation. So be very wise. Be very, very careful, especially when measuring visual acuity. Thank you very much.